Well, these days, you'd be hard-pressed to find someone who isn't affected by depression. Maybe your friend or a family member is dealing with it.
Or it could be something you're facing right now. Just know you're not alone. In fact, the National Institute of Mental Health estimates some 21 million people suffer at least one major depressive episode in their lifetimes.
And while many will turn to medications to get help, there are some who just don't respond to pharmaceutical solutions. Well, tonight, Karen Fuller takes us to a place right here in Arkansas that's helping people in that group faster than ever before.
We are still very early on. We learned that we were definitely going to move forward with opening up this program in March.
Dr. Amy Grooms has good reason to be excited for a new treatment now offered at the UAMS Interventional Psychiatric Research Institute. It's the first of its kind in the U.S., and already patients whose illness is resistant to medications are calling for appointments from across the nation, some even outside the country.
One of the things that I've come to appreciate in my job is that everyone's depression, everyone's experience is different. But what patients have told me when they start feeling better is just this lightning feeling back to themselves.
It's called the SAINT Neuromodulation System, developed by Magnus Medical. Patients first undergo an MRI scan of their brains. That acts as a map for targeted treatments of transcranial magnetic stimulation, or TMS. Dr. Groom says TMS is nothing new, but what sets SAINT apart is how fast it's done and how quickly patients respond.
What SAINT does is it scrunches it all together, so it's just 5 days.
And the results are?
And the results are very promising.
Patients sit in a comfortable chair with cords gently attached to their heads for nearly 10-minute sessions 10 times a day for 5 days. Using the MRI map as a guide, technicians can precisely target areas of the brain in need of the neurostimulation.
What we have found with depression and looking at the neuroscience research is that you have neurocircuits that become underactive or overactive. The idea with neuromodulation therapies is to restore a balance to those neurocircuitry.
The SAINT technology requires a powerful magnet many institutions don't have. In 2021, the Brain Imaging Research Center at UAMS had replaced its older MRI scanner with a newer and far more accurate magnetic device weighing 13 tons. As you can see, it was no small project to install. But because of the magnet's capacity, Magnus Medical chose UAMS to become the first center of its kind in America.
Looking at the studies that have been done that supported the FDA approval for this treatment, you're looking at 80 to 90% of people achieving remission, not just response, but remission, where your symptoms are resolved.
And while the results are remarkable, even if they should taper off some, it's a game changer for patients waiting months, even years, for something this revolutionary to come along.
As a field, we're not done looking. We're not done researching. We're not done trying. Just because this newest cutting edge modality doesn't work for a person, that doesn't mean that nothing will work. And it also doesn't mean that they have to go through things by themselves.
That was Karen Fuller reporting. Right now, Medicare is the only insurance that covers the SAINT treatment.
But Dr. Groom says when a major carrier like Medicare is on board, other companies do typically follow.
The SAINT treatment is being done at UAMS now on an inpatient or outpatient basis and is open to anyone.